Now that you have powered up the tablet, we are ready to show you how to perform a GEMPro sleep test. The GEMPro test will give you valuable information about the quality of your sleep. It will tell you whether you snore, grind your teeth, and breathe normally while you are sleeping. Watching this video from here on out will tell you how to initiate the test. When you are ready to perform the test, open the case and locate the pulse oximeter and BioBrux amplifier. After you plug in the tablet, return the tablet to the case. Remove the BioBrux amplifier and the wrist oximeter out of the case. You will then need to touch the blue and white tooth icon on the tablet home screen. This will be the app you will use tonight to run your GEMPro test. Once the Physioplex for Bruxism app, which is the blue and white tooth icon, is selected, the main screen will display. At this point, you need the PIN your dentist provided to you during your appointment. This PIN should be written on an appointment card. Type in the PIN provided by your dentist in the highlighted field labeled Patient Login. All you must do is touch the box under Patient Login and a keyboard will appear, allowing you to type in the PIN you were provided. If you cannot find your PIN or you have lost your PIN, please call your dentist office to retrieve it. The screen will advance once the correct PIN is input under Patient Login. You will be asked to plug in the tablet, if you haven't already done so, into a power outlet close to your bed. To plug in the tablet, use the USB charger provided. View the picture to show where the USB cable inserts into the tablet. If the screen did not advance after typing in the PIN, you will not be able to proceed. If you are unable to proceed, a common mistake is confusing zeros and O's and I's and L's. Re-enter the PIN with what the alternative similar choices for these letters or numbers are. Now that the tablet is plugged in, you will be prompted to turn on the pulse oximeter. Place the thumb sensor on your non-dominant hand, then wrap the oximeter around your wrist and secure using the buttons. When you turn on the wrist oximeter, press the button on the side of the oximeter as shown until you see a red light on the thumb sensor. If the green check mark does not appear, you will see a prompt to reconnect after you confirm the oximeter is turned on and you see a red light is on the thumb sensor. Then press the connect button on the tablet and tap the power button on the oximeter a second time and the green check mark will appear. Once the green check mark appears, do not remove the thumb sensor during the study. If for any reason you do not have a red light on the thumb sensor, tap the power button when you are close to the tablet. Next, the tablet will prompt you to power up the BioBrux amplifier. To turn on the BioBrux amplifier, move the small black switch to the up position. To indicate that the BioBrux amplifier is on, there will be a green blinking light located in the center of the amp. Once the BioBrux amplifier is detected, the tablet will advance to the next screen. Once the screen advances, the blinking green light will automatically be turned off, but the amplifier will remain on. If the BioBrux amp was not detected, a dialog box will appear indicating to connect. Tap Connect. This will connect the BioBrux amplifier to the application. Once the tablet is plugged in and both sensors are detected, the tablet will advance to the next screen. The tablet will ask if you are applying therapy. Choose the appropriate answer. For example, will you be wearing a guard or night splint in your mouth when you go to bed? If yes, this is considered therapy. Once you touch either yes or no for therapy, the tablet will automatically advance to the next screen. The next screen shows images of where to apply the BioBrux sensor. The left picture shows the placement of the EMG sticky pad to the cheek. The right picture shows the BioBrux amplifier on the pajamas or shirt. You will need to wear a shirt or pajamas the night of the GEMPro test. To attach the electrode to your cheek, pull off the plastic shield on the electrode. This exposes the sticky pad of the electrode. Locate your cheekbone and jawline. Bite down, then feel for the bulge in between your cheekbone and jawline. After locating this bulge, place the sticky pad of the electrode on the bulge you located on your cheek. Be sure to have cleaned off the surface of your face where the electrode is to be placed and do not use face cream the night of your test. If you have facial hair or a beard, please shave prior to sticking the sticky pad to your face. The sticky pad will not stick through hair, facial oil, or lotion. To attach the BioBrux amplifier to your nightshirt, raise the plastic tab on the clip labeled Lift with your index finger and thumb. Then place the clear plastic clip on your nightshirt or pajamas so the arrow on the amplifier is pointed up. Once the primary clear plastic clip is attached to your shirt, take the black strap with the silver clip and clip it to your nightshirt. This black strap acts as a stabilizer for the BioBrux amplifier. The tablet screen will indicate an OK when the BioBrux amplifier is in the correct position. Tap Next to advance to the next screen. The next screen gives instructions on how to place the oximeter. You will have already placed the oximeter, and this image shows how it should look. Touch Next to advance. The next screen will display an image shaped like a head with a number in the center. Once you press the Start BioCal button, you will go through a series of 4 motions where you will relax your jaw muscle for 7 seconds, then bite down as hard as you can for 3 seconds. The screen on the tablet will have a button called Start BioCal. When you touch this button, the image shaped like a head will say Relax. You will relax for 7 seconds, and then the image shaped as a head will say Bite down as hard as you can for 3 seconds. These instructions will repeat 3 more times, and once 4 bites are collected, the tablet will automatically advance to the next page. It is important that you bite down as hard as you can. Do not worry if the bites and relaxes do not occur exactly when instructed. It is more important to record 4 hard bites through this calibration. If the system does not detect the bites, you will be prompted to repeat the BioCal. Once the BioCal completes, the screen automatically advances to the audio calibration page. Before you press the Start Audio Test, make sure you turn on any fan, radio, TV that you leave on while you're asleep. This will help clear up any static noise during the test. Now, touch the Start Audio Test button and wait quietly for 10 seconds while the system listens to your room noise level. A timer will count down from 10 to 0. The audio test will measure the background noise that you expect to have while you are sleeping. Once completed, the tablet will automatically advance to the Start Study screen. Now you are ready to start your GEMPro test. To begin your test, touch the Start Test Now button. Once the test is started, place the tablet back in the case and close the lid, and place the case underneath your bed or some other location where the light from the tablet will not bother you. You will not need to interact with the tablet again until you are ready to end the test when you wake up in the morning. If for any reason the study ended prematurely by accident and you have not successfully fallen asleep, you may start the test all over again by touching the blue and white tooth icon on the screen and re-enter your PIN and step through the startup process a second time. Once you do click End Test, a dialog box will prompt you to confirm you are ending the study. Click Yes. There will be a short pause while the tablet generates your report. Then you will be prompted to click the Next button located on the upper right-hand corner of the tablet. Finally, you will click OK to close the app. Once the study is ended, carefully remove the EMG pad on your cheek and unclip the BioBrux amplifier from your pajamas or shirt. Finally, remove the pulse oximeter from your thumb and wrist. Place all items back in the case and return the device back to your dentist. If you are testing a second night, remove the sticky pad from the night before and put a new sticky pad on the wire that is attached to the BioBrux amplifier. Then, make sure the BioBrux amplifier is in the off position. To charge the oximeter, remove the finger sensor that is plugged into the wrist oximeter and plug the USB cable with the green tip into the same location the sensor was plugged into. Plug both devices into a wall outlet when you wake up so the devices are fully charged for the next night of testing. When the BioBrux amplifier is fully charged, the LED light will turn from green to purple. You will know the oximeter is charged when the oximeter USB cable is plugged into the charger and the screen is blank. Otherwise, while charging, you will see a blinking battery. The pin your dentist provided can be used any number of times to perform new tests. Our goal for this video was to prepare you for a GEMPro test. We hope we've achieved that. Have a good night's sleep.